Yeah, we're definitely worried about the triple threat of COVID, flu, and RSV. Um, it's interesting. I work out of two small rural hospitals, and over the past decade or so, there's been a lot of consolidation of pediatric inpatient services to larger facilities, larger urban hospital settings. So the presence of flu and RSV hasn't hit my hospitals too hard, other than in the emergency departments, in the outpatient practices, and in our ability to transfer folks, quickly from one location to another.
I have read that some places are seeing lots of cases and other places haven't been hit hard. Do you expect it to just get worse where you are, or do you hope it will kind of stay the same?
Yeah, I think it's likely to get worse before it gets better. The respiratory season in upstate New York lasts a long time. Generally doesn't, come to a conclusion until, March, April, May of the following year. So we have a long haul ahead of us.
Right. And a lot of people feel that COVID precautions aren't necessary anymore because COVID cases are going down. So I kind of wanted to touch on that because are COVID cases going down?
Well, I will tell you that COVID never really went away. It never really went away. I think the public may have this perception that the pandemic is over or is rapidly coming to an end. But for local hospitals, we've maintained a fairly steady level of COVID related admissions throughout the summer, throughout the fall, into the early winter. Um, it has not overwhelmed us, thank goodness. It hasn't hit us to the same degree that we've experienced in previous winters, but we are concerned it could worsen over the course of the next couple of months.
Does it seem like the flu and RSV are kind of falling into the place where COVID was, like they're the predominant or dominant illnesses right now?
Yeah, I don't have any data, upon which to sort of answer that question. I think all three are a significant concern. When you talk about the combined impact of COVID infections, flu infections, and RSV infections upon healthcare organizations right now, particularly hospitals, um, they really do. All three have a tremendous impact. Particularly for smaller hospitals, if you're filling 5, 10, 15% of your beds with these cases, there's just not much room left for those with other medical conditions.
What's different about the flu and RSV this year compared to both the last 2 years and then even before COVID existed?
Yeah, I'm not sure that there's anything particularly different about those viruses. I think what's different is the population. We've had a couple of years in a row where we were instituting masking, we were instituting social distancing, we were spending less and less time with one another in indoor, congregate settings. There is a bit of a what we refer to as an immunity deficit, particularly among children, that makes them more susceptible to flu and RSV. Unfortunately, there's still a percentage of the adult population that has been reluctant to receive COVID vaccination, and they remain a very vulnerable population as well.
So, what can people do with the holidays approaching to be as safe as possible and not get one of these three illnesses?
Yeah, well, I mean, number one, the most important thing, frankly, is to get vaccinated. Get vaccinated, right? Flu shots are strongly recommended for everybody 6 months of age and older. And of course, there is now a bivalent COVID booster available that came out around Labor Day. And the good news is the bivalent COVID booster seems very effective against the Omicron subvariants that are currently emerging and causing most COVID illness. It's really, really important to remember to wash your hands. It's super important to remember to, cover those sneezes and coughs. if you're feeling ill, please stay at home. Don't only consider yourself, but consider, those in your family and in your workplace who, may be at greater risk for illness. When you're making those decisions about whether you should go out, into public or not. I think if we, again, care for ourselves and think a bit about those around us, we'll be a heck of a lot better off this winter.